My name is Jessica Ross. I'm the Director of Nursing for Alliance Recovery Center. I've been with the company for about 6 years. There's so many different things that I love about this company. However, I would say that my favorite thing about working for Alliance is my patients. Typically when our patients come in on intake, we don't get to really meet who they really are. About a month after they start dosing, we meet a completely different person. With therapy, the medication, coming in every day, going to groups, people really start, it's a completely different person that we get about a month in. The hardest thing that I run into is just the stigma within healthcare with my job. A lot of people don't understand what we do with medicated assisted treatment. There's a lot of misconceptions. There's still a lot of doctors in the field that are uneducated about methadone. A lot of ER doctors that see my patients just really don't know what its properties are, what it's used for, what it interacts with. And the stigma is just hard for our patients to seek, healthcare outside of here, to talk to other medical professionals about it. So I think that there's still a lot of stigma surrounding methadone as a treatment process. So I think that part of my job as director is just to really get out there and try to break some of that stigma for my patients. Still, people consider it substituting one drug for another, and not understanding methadone as being dependent versus addicted. Like, you wouldn't tell someone that they did not need to take their blood pressure medicine because they were going to become addicted to it. So it's a dependence. We're just meeting people where they're at, and we're, filling those receptors in their brain and allowing people to get their lives back. Working here for 6 years and talking to someone 6 years ago versus now, I think that, once the opioid epidemic became a household name, I think that it's been a lot more acceptable to talk about medicated assisted treatment. I think that people are responding to what we do a lot more than they used to, and by responding, not only accepting it, but considering it as, an advantageable treatment modality for people, that it's actually helping people restore their lives, or creating a life, even, not even restoring a life. The abstinence community is starting to listen to us more, and I think that it's just a better dialogue than it used to be. I think that, when they reclassified all of these opioids, and, like I said, when it became a household name, the opioid epidemic, I think that people were losing their loved ones, and, or just people that they knew in the community. And so I think that, it created an alarm for people that we need to do something about this. And I think that the future is going to be a whole lot better through education. I do think that medicated assisted treatment is effective as other pathways. I find it to be the gold standard.